Hello, this is Dr. Lori. Welcome to this discussion about experimental cohort studies. So what I'd like to do is give the overview of experimental cohort studies and some of the things that we call them, and then talk about what the strengths and limitations of this particular study design are. So first of all, let's draw what a cohort study looks like. Basically, if we're doing something that's a prospective, not have that line there. If we're doing a prospective study, this is the now. This is today, what we're doing. So we collect up a group of people. We call that a cohort. And we find out who's exposed. Yes. And who's exposed or not exposed. So the yeses and the nos. And then we follow them forward sometime in the future and find out who had disease or no disease. And same thing for the experimental or the not exposed, disease versus no disease. And ultimately, then we want to be able to compare these groups. We want to compare who ended up having disease to who ended up not having disease, and find out somehow if that relationship between exposure and disease is really there. Now, with an experimental cohort, the thing that is interesting is that we assign people to either be in the exposed yes group or the exposed no group. And that's what makes this an experiment. So the defining feature is that the investigator assigns exposure. And so this is an experimental cohort. To contrast that with an observational cohort, in an observational cohort, we just simply watch what the patient is doing. Do they eat lots of vegetables? Do they take a certain over-the-counter medication? We're just watching, we're just observing. And so the main difference then between an experimental cohort and an observational cohort is this assignment of exposure by the investigator. Now, by assigning the exposure, what we're really trying to accomplish is keeping all the other variables roughly the same between those two groups. And so if we have all other kinds of things, we have race, ethnicity, we have gender, we have maybe other life choices, occupation, that people are exposed to different things. We want to have those things be as same between these two groups as possible, so that when we get out here and we're looking at whether people ended up having the disease or not, we can say, well, if everything else is the same, except for this exposure, yes, no, then we can have a stronger evidence that it's the exposure that made one group much more or less likely to end up having the disease. So that's the idea with assigning exposure, is to try to have those two groups on average not have other reasons that the disease would be different, differences in age, distribution, those kinds of things. Now, because we have to follow forward in time to sometime in the future, one of the downsides is that it takes more time. So this is a disadvantage. It's also expensive to do all of this, to assign exposure, to follow forward in time, to keep track of people. And so these experimental cohort studies tend to take a lot of time and money. The other limitation that we have with experimental, the fact that it's experimental right here, the fact that we're assigning exposure, there are two pieces to the ethics on this. First of all, when we assign somebody to this yes exposed group, we have to make sure that we aren't assigning somebody to a harmful substance. We have to genuinely wonder whether this is going to be helpful to the research subjects. We can't assign them to be in smoking or non-smoking, for example. So there are a lot of things out there that we cannot do experimentally because we have some evidence that that particular thing that we'd be studying is harmful. So we can't assign somebody to be in a harm group. The other ethical issue is this group of not being exposed. If we're wondering, if we have equanimity about whether this new exposure is good or not, we have to be careful about this not exposed group. If we have certain treatments that we know are actually effective, then this can't just be no treatment. We can't do that. We have to have this comparison group maybe be the existing therapy or the most common treatment or the standard of care. And so for both of those reasons, we have to be really careful about the way we design our study from an ethics perspective. We can't assign them to a harmful exposure intentionally, and we can't assign them to an ineffective comparison. The other big issue that comes out of this whole idea of assigning, that it's experimental, so we're assigning exposure, is that when people get assigned to a particular group, either the yes or the no, they may be unhappy about that. And so we may have people who are assigned to not receive the treatment, but then they go and they get it anyway somehow. Maybe it's an over-the-counter that we're studying, or maybe it's a dietary intervention. And so they might think that that is going to be a good thing and they don't want to miss out on it. Or it might be that when we assign them to some therapeutic, that it has side effects that they are bothered by a lot. And so then they were assigned to receive a treatment and then they don't. And so they don't take it. So we have what are called dropouts, or people switching from one to the other. So because we're extending over time, we might lose track of people. They might stop coming to their appointments because they don't like the side effects of what are happening to them. So these are some of the drawbacks or the limitations of experimental cohort studies. Common types of experimental cohort studies are vaccine trials or drug trials. And so these are very controlled. We have a very specific question that we're asking. We can theoretically study multiple diseases, but it can get tricky if we're creating a study that is powered. We have a sample size to have a certain amount of power for one disease, and then we don't have the correct power for another disease to be able to pick that up. So we just have to be really aware of that. So the defining feature is that the investigator assigns exposure. There are some other very interesting features that are only found in experimental cohort designs because of this assignment of exposure. Now, it is possible, and I'm going to draw this down here below, it is possible to have an experimental cohort study where all of the subjects are assigned to exposure yes. And I'll give an example of that here in a minute. But most commonly, this assignment that we are doing right here is randomly assigned to either the exposed yes or the exposed no, and we call that randomization. And so that's an important feature that we only have in experimental cohort design because of this assignment, because they're assigned to which group they're going to be in. So randomization is unique to experimental cohort studies. If we're just observing what people are doing, they choose their own group, they choose their own exposure. So we are not randomizing them to be exposed or not exposed. Because we're assigning them also to these two, we can make it so that the study subjects don't know if they're in the yes or the no group. And that's called blinding. We can have blinding on multiple levels. We can blind just the subjects, the people that are in the study. We can also blind the investigators. We can blind the people who are doing the analysis. And so by not letting people know who's exposed and who's not exposed, then we can remove some of the bias that people might have ahead of time. And then the other thing that we can have that's unique to experimental cohort studies is what's called placebo control. This group that is not receiving the exposure, whether say it's a vaccine or a drug trial or something like that, we can give them something that looks, feels, seems exactly the same as what the yeses are getting. And so that's called a placebo control. And you'll hear this, a randomized, double-blind, placebo-controlled trial is the strongest level of evidence that we have about a particular exposure-disease relationship. Now, I told you that we can have an experimental study where everybody is in the exposure yes. And I'll give you an example of that. When they were doing the initial hepatitis vaccine studies, there's a group of people who have chronic hepatitis, and so they develop hepatitis. They don't just get sick with it, they tend to keep it, and so they have it long term instead of having the illness and then getting over it. And so what they were wondering is, does this hepatitis vaccine, will it cure those people who have chronic disease? And so they took a group of 12 individuals who all had chronic hepatitis. They knew, based on just the nature of the disease, they had never ever seen anybody who had chronic hepatitis ever become not chronic hepatitis. And so basically their comparison group was their knowledge of the natural history of disease. And so all 12 of them were assigned to receive the hepatitis vaccine. They were followed forward in time to see if they reverted to then not having chronic hepatitis. And the answer was no, unfortunately. They all still had chronic hepatitis even after receiving the vaccine. So that's an example of a non-randomized. There was no comparison group. The comparison was to our knowledge about just the natural history of chronic hepatitis. So we didn't need to randomly assign them to yes or no because we already had the answer to what the no's would be. They were just kind of like out there in the world. So randomization is not an automatic feature of an experimental cohort design. So that's a myth. The defining feature of an experimental cohort or a clinical trial is not randomization. It's the investigator assigning exposure. And so that is such a common myth that you'll even see that sometimes on test questions. What's a unique feature? What is the defining feature of an experimental cohort? And people think that it's randomization, or people will think that it's blinding. These are unique. They're only found in experimental cohorts, but that's not the defining feature. A placebo control. There are a lot of studies where the standard of care is used in this not receiving exposure. And so that also is not the defining feature of an experimental control design. So even though those are unique features to experimental cohort, that's not what defines it. You can have an experimental cohort study that does not have a comparison group. There is no randomization, there's no blinding, there's no placebo control. And so just keep that in mind. The defining feature is that the investigator assigns exposure. Now, there are 3 different kinds of experimental cohorts or trials. We call these trials. Because we're trying something, we're assigning something and trying it out. There is the clinical trial, And we see this as RCT, randomized, controlled. So do you see how here we have randomized, controlled trial? There's something called a field trial. This is trial. And there's something called quasi-experimental. Hope you can read that. Quasi, Q-U-A-S-I. Boy, that just got worse. Sorry. We'll put it back. Quasi-experimental. So in a clinical trial, the people tend to be sick. And so they have some kind of a disease. Maybe they have diabetes or cancer or something like that. And then we're going to give them something, this exposure, we're going to expose them to some medication or some kind of an intervention and see if that helps them to get better or maybe not get worse. So these are sick people. In the case of the vaccine trials, these are generally considered to be field trials because these are healthy people. In general, maybe there are people who do not have hepatitis. We give them, maybe they're a high-risk group, we give them the vaccine and see if the vaccine prevents them from getting the hepatitis. Or measles, we give them the measles vaccine and see if it prevents them from getting measles. And in both of these cases, we basically do this, if we're randomizing, we randomize them just individually. Each person who comes into the clinic is a unique entity. It's almost like a flip of a coin. Do they get in the exposure or the not exposure group? We want to set that up in such a way so that our two groups, otherwise, besides the exposure, are reasonably or randomly similar to each other. In a quasi-experimental design, I've seen this used in a variety of different ways. Either the randomization is on a group level, and you'll see that in a paper that we're going to evaluate, or the exposure is kind of like a natural disaster. It's not technically assigned by the investigator, it's because something happened. I'll just call it, the most common would be a natural disaster. I've seen both of those in the literature called quasi-experimental. Let me explain each one. So this natural disaster could be like the potato famine that happened in Europe. And so during the potato famine, there were a lot of people who had a very low calorie diet. And so an experimenter would never intentionally expose somebody. You couldn't expose somebody to a very low calorie diet, but they looked at what happened to the pregnancies, what were the outcomes of pregnancies during this time when we had this potato famine, low calorie diet. Another example of a natural disaster would be, say, a power plant explodes or something like that, and so the people around that nuclear power plant are all exposed to radiation at a certain level, and so we follow those people forward and find out, what's the end result of this natural disaster. It's not something that the experimenter can assign because it's harmful, and so we call that quasi-experimental. There may be other features about the group that lived closer to the power plant that is different, but in all essences, they didn't select to be in the group that was exposed versus not exposed, and so it was something that was kind of foisted upon them. So you'll see that called a quasi-experimental. The other quasi-experimental happens when the exposure happens, and I'm calling this on a group level. And so, for example, let's say that we think that putting billboards up in a community is going to help improve infant health. Maybe we're advertising about a program that the county health department is putting on. Maybe we're just encouraging people to be healthier. Now, we can't just kind of like, as people are randomized to one group or another, we can't take the billboard down and put it back up, take the billboard down and put it back up. And so what we do is we randomize communities to either receive the billboard or not. We might randomize if there's a certain clinic procedure that we put in place that makes the care better. Maybe it's more comprehensive, or you have a nutritionist and a nurse practitioner and a social worker, and you have this set up, the way the clinic is set up gives a certain kind of care, and then you have clinics who don't have that set up yet. And so all of the patients that go to that particular clinic or live in that neighborhood with that billboard are considered in the exposure yes group. And then all of the ones who did not receive that particular experimental intervention would be considered in the exposure no group. So sometimes we randomize on the group level. We would basically take all of those communities or all of those clinics and say, okay, well, this particular clinic, we're going to do this new intervention where we have the nurse practitioner and the social worker and the nutritionist. We're going to set it up this way. It hasn't been so far, but we're going to implement this new thing. And then these other clinics, maybe, just to be fair, we're just going to wait to set it up that way until we have the results of our data. And then that particular community will receive that way that the county health department clinic is set up. So if we're randomizing on a group level, then that would be considered an example of quasi-experimental, because we aren't randomizing each person, each sick or healthy person, to be in the exposure yes or no group. So that is an overview of experimental cohort designs, and I hope you enjoyed this video.